Now I'll pass it on to Dr. Hema Divakar. Over to you to take this discourse forward. And we are looking forward to see some wonderful work of many organizations who have been doing tremendous contribution to the health of our country in the evening today, and recognize many of them. Thank you so much for being with us.
Thank you.
Thank you. Thank you very much.
Thank you, everyone. Thank you.
Namaskar. Thank you, Kamalji. And my heartfelt congratulations to the brilliant panel, which has just concluded with many, many more insights into what we can do as a part of CSR, which is typically as a corporate social responsibility. But C is also for a collective, and the philosophy of connect and collaborate very well demonstrated by IHW Council as always. And S is not only for social but sustainable responsibility, because it's often said that well begun is half done. Yes, ladies and gentlemen, it's often half done. That is the problem. It's so easy to begin something, but to sustain it, to scale it, to make an impact, there lies the challenge. So we have a very brilliant set of panelists in a panel which addresses how we have connected today in the COVID pandemic through technology. That is the power that we have harnessed, and any CSR activity requires the money. It has a vision. It has to get into action. And when you do implement it, you need some way of seeing the impact of where you have done what, and seamlessly the technology seems to be holding the bridge, the thought process and the action, and followed by the impact. So we are going to see in this panel today how the CSR implementation and the outcome that is expected can be tapped through the power of technology to learn your lessons, to get your big data, to check out whether you're on the right track or not, and see how we move forward. So I welcome on this panel, fondly on my own behalf and on behalf of the IHW Council, Kamalji and the team, Suja Warrior, who is the Corporate Diversity and Inclusion HRD Head of the Infosys Limited. Hello, Suja. Welcome to the panel. Sakina Backer, who is the Head of the CSR at the Philips India Limited. Kumar Anurag Pratap, the Vice President of the Digital Inclusion and Sustainability Leader at the Capgemini India. Nidhi Pudir, who is the Director of the HCL Foundation. And last, one of our very favorites, Raghavendra Prasad, the founder of Step One. So let's take that first step with Rags, as we very fondly call him. Story from rags to riches, if I may say. And the richness is in harnessing the technology for the benefit of mankind. Raghavendra, the first question to you. When you took that step one, knowing fully well with more than 2 decades of your industry experience, that here is an opportunity in the challenging times of COVID-19 that you can turn something around to connect and reach people where it is needed. So it's like a chicken and egg kind of a situation. Was COVID waiting for the technology to be exploited? Or was the technology always there and you wanted to explore it, but you didn't have it? So what has been your experience with Step One, both in the waves that you have made in the COVID-1 and COVID-2 waves, if I may say? Raghavendra.
Yeah, thank you, Dr. Hema, for that warm introduction. So the Step One was actually born as a not-for-profit from experience of starting companies and running them and scaling them. So it was born by a team of technology entrepreneurs and founders who have who don't I mean, at least I don't have, and most of the people who we got together to build Step One don't have much of a non-profit experience. We all have used technology to solve people's problems in a commercial setup, and we are very much used to running startups in a very fast-paced, fast growth environment.
Right.
And we knew that technology is going to become extremely important in this fight against COVID. All forms of technology, but particularly communications technology, which is very important to equip people with the right information, connect common citizens with as many medically trained professionals as possible. And there was no way that we could do that by bringing all of them under one roof, or bringing them to a physical location. And technology was the only way to make that happen.
Yeah.
And in fact, if not for technology, we wouldn't have we wouldn't have been able to make the kind of impact that we did. Just in the second wave, we have been able to provide 3.6 million people with access to doctors, 3.6 million teleconsultations. And that's the kind of impact that a lot of nonprofits, which are traditional, who don't use technology, strive to do in their entire lifetime, right? We've been able to do that in a matter of few months, basically because we made technology as the core of our reach out to people. So doctors who are consulting and providing these free teleconsultations to the COVID affected patients, they are able to do this in the comfort of their home, which means that a larger number of doctors can volunteer. They need not fear of getting exposed to the virus themselves. A larger number of medical students, nurses can participate in this effort. So I feel technology, if harnessed in the right way, can go a long way in providing relief. And I think a lot of I feel any organization, whether it's a not-for-profit or for-profit, if you're able to clearly define your goals, and if you're able to systematically work towards achieving those goals, and use every management principle that is required in a non-profit setup, you can actually scale very fast and have a very huge impact, like it has been demonstrated with Step One. And but the key thing which I have learned over the last few more than a year or so fighting COVID with Step One is the kindness of people. I think there is an inherent good nature among thousands and thousands of people. I think there have been over 25,000 people who have been associated with Step One: doctors, medical students, nurses, and also normal citizens, corporate employees, CSR organizations of various corporates who have seconded their employees and encouraged them to participate and support on this platform. Right. The inherent kindness in the society has been in a very, very large manner channelized to some good work via Step One. And I think that, I would say, is the key learning. The more easy you make it for people to participate, there is and use the latest technology to enable and give them comfort. To do that, they will participate more and more.
Ravindra, two small follow-up questions on this. Beyond the COVID era, COVID, of course, doesn't seem to be a full stop. It's a continuum. We have all learned to accept it, and we will manage. But beyond the peaks of the COVID era, how sustainable and impactful do you think the Step One, with the kind of work that it's doing, it will continue? And how, more important question is, the kindness. It was only in the crisis that people rose up to the occasion, or how do you think the kindness also could remain sustainable? What is your take on that?
Well, I think we have the scale that we have attained is potentially unparalleled. It's still yet to be seen whether we will be able to reach this kind of a scale in a non-pandemic scenario. But what has clearly proven is that public health delivery via technology is something that is here to stay. You yourself have been a pioneer in use of technology in public health, and there are so many initiatives that you have yourself taken up, and all of these are at a very early stage. It will require a lot of effort. For example, women's health, right? There's so much. I think we are in a unique era where practically all of India we can individually reach the people via technology, right? We can have a one-on-one conversation with them. And this opens up so many possibilities, and use of this opportunity to communicate the right health messages is here to stay, and it will only get enhanced as we go forward. And public health is a lot about the right communication at the right time, and hopefully we will public health we can use technology to enhance public health and focus on the preventive aspect of healthcare. And I am hoping that this will only get enhanced. On the kindness part, I think we need to figure out a way to blend volunteering with full-time people, and I feel that is very much possible. Several organizations have done that. I think Gunj is an example. There are so many organizations which have done that. I'm myself learning, given and I think MAD they have done that extremely well. In fact, they have done a 100% volunteer model. So even CRY has done as mixed volunteering with paid people, and I think it will continue in that manner. Getting the right mix of paid and volunteering post-pandemic will become very important to keep it sustainable.
Right. Thanks, Raghavendra, because the two words which you used, the cry, people were crying out there, and some mad people, some crazy people who thought who could reach out to them and help them, did it all. And more power to you. In step one, many more steps to go. I agree. And it has been a necessity of sorts in the pandemic, which has given a very unique experience to everybody who has been a part of it on both sides, the provider sides and the healthcare seeker side, which have experienced the timely connect and the necessary actions, which have transformed many tension-filled moments into life-saving experiences. So hearty congratulations for the initiative that you have started, only waiting to be scaled up and remain there forever and ever. Thank you, Raghavendra. We shift now to Suja. Suja has been, has seen both worlds. Many initiatives in the metros connecting to the second tier, third tier cities, and even the remote tribal areas. Suja, I want you to say about the exploratory opportunities, the tremendous potential of getting the reports onto the doorstep of the doctor from any part of India with the help of technology, whether it's CT or MRI. You need specialists to interpret those reports which lie on your desk, and you can't reach there. So access is a problem, but the technology enables it. So can you just reflect on some of these examples which have made a difference to the healthcare, the reach, and also the benefits of investing the corporate funds into initiatives such as this?
First of all, namaste to all of you. I am very thankful to Shalu, Kamalji, and all others, Hema, for getting me in this platform, because I am with some of the most efficient and eminent panelists here. Thank you so much for making me a part of this conversation. And having said that, I would like to say that if you look at the pandemic started in the year 2020, Infosys Foundation is the first CSR body came forward and said 100 crore for the pandemic relief work, rehabilitation or whatever. So the thing is, at that point of time, we were not even knowing what exactly is happening, what is the way we can contribute. And we have maybe at very, very initial stages, nobody had any clue. And we all thought that within 3 months we'll come back to office. But that is not what happened. And we found that on emergency basis, we were set up hospitals. I can say that Bowring Hospital with a separate ward for almost 140 patients and 140 beds. Thousands of people got treated. There are Chinmaya Mission hospitals and then Ramakrishna Mission hospitals. Lots of hospitals were supported by the foundation's work. And that is maybe the physical infrastructure and support system at that point of time, including the salary for the staff in the hospitals and all the food, nutrition and PPE kit and you name it, oxygen supply and all kinds of things we have provided. But having said that, the technology is the space we are in as an organization. Infosys is basically a technology company. We are good at it. So we all know that to scale up any initiatives, we need technology. And I still feel that, of course, I am a person who loves to work on the ground, and my contribution during this period was very minimum. Otherwise, I would have been in one of the areas where I will be working on the ground. Maybe in the initial stages, I worked for 10 days or something for packing the food for migrant laborers and traveling to West Bengal or somewhere in these railway stations, we were supplying food, maybe supplying food to some of the local community and supplying the kits to people. And later I was a part of the vaccination drive in the city. I was sitting and I wanted to experience the what is called the exposure in the COVID time, in spite of like I did not even have the vaccination done at that point of time. Still, I wanted to be a part of it. But later I found that that is all the basic things which I could do as an individual, but organizations are really working hard on this space and their contributions are really big. And most of the companies have contributed in a big way to this particular period. And step one is something which I was like a kind of checking every other day what is happening. I even wanted to contribute some way or other. But I wanted to say that in that period, what I learned, or maybe any other citizen in India across the globe learned the space technology. Over a period of time, we all become tech savvy, and
Suja, maybe if you shut down your video, you may.
Code, postal code. Yeah. So I was so happy that, okay, this is the technology enablement. And then the telemedicine services. I don't have to go to a hospital during this COVID time. And then the e-pharmacy, a thyroid care person, the laboratory person is coming to my home to check the blood test. And the report is coming in the WhatsApp or email. And then there are X-rays or MRI scan, radiology, and all kinds of things, which is happening with a click of your mouse. And this is something which I felt that this is the power of technology, even though I am using. But at the end of the day, what I felt is, of course, the technology is powerful, but it is applicable only for the haves. There is a set of people who are not having any of these things. Especially the person, I am talking about a country or a state where it's supposed to be the 100% literate. There are places where technology is not still available. There are places where they cannot even access the very minimum phone with no touch screen. I'm not even talking about the touch screen, the regular phone. They don't have the accessibility, they don't have the electricity. And I know that where I lived for years for working for the community where electricity is still a dream, even though many people have that mobile number with the 20 rupees, 30 rupees recharge they are doing. And here I am sitting in a city, I am seeing the development, I am seeing the technology enablement, I am seeing the people who are using a mobile for reaching out to anything, everything. But I think as a country, as a person, as an individual, as a group, we all have to work towards getting those have-nots into the have space. And the community still have a huge divide. And for me, of course, I am so privileged because I am working in a company with all facilities. My salary was not cut. My food was not reduced. My facilities were not at all interrupted. I was having everything. But what exactly we wanted is all of us have to contribute something to make everybody inclusive. Especially I am working in a space called the diversity and inclusion with the disability and LGBTIQ and gender is one area which I am focusing on now. I wanted to see all of us are inclusive and the collaboration and commitment towards making the place inclusive and a healthy nation is something which I am really dreaming for.
I wish, Suja, you will win, because to win, you have to begin, and you have begun on a right note. Because, see, the haves and the have-nots you're talking about, I'm sure it's based out of the experience in the tribal areas where you have actually seen that they don't have any connectivity and it's very difficult anyways, even for the physical access, etc. So presuming that one day we will reach there. One day, let's just imagine a situation where everybody has the reach to the technology. Still, do you see some challenges in the mindset of people, and also the learning curve for, those who are not habituated and those whom we typically call these not so tech savvy? Many of the doctors also, we know that they are not just initiated into this. Do you see that as a huge challenge, or do you think the generation next is anyway, they're waiting in the wings to take over? What is your
take on? There is a change in the mindset. There is a change in the way we are thinking. But I still feel that when I look back, like the way I worked in the tribal areas, we used to have the mental health camp. I was a part of the thing. We used to have 1,000 people, 1,500 people coming to a camp for getting the medicine. So for the slips, we used to write the slips, and the people are illiterate, they can't read it. What we used to do for a night medicine, we will create a picture of a moon, or daytime it says full moon means night, or maybe in the sun for the 12 o'clock medicine, and that was the way we used to work. And that time it was so, even today it is a big challenge that the communication is a big problem, because for any time there is a natural calamity can happen, a flood can happen. We won't be able to reach out to the villages and say that today the camp is not happening. And then fortunately, some of the places we have access to mobile, so the communication is becoming slightly difficult, improved, and we can able to tell them that, okay, the doctors are not coming today, may not be the camp is happening. But still, I feel that the internet is still a problem, and also the public health centers in those areas are not equipped with enough medicines. And of course, now the technology can enable them with the training, required training, or maybe a consultation through telecommunications, this thing. But still, I feel that there is a touch and feel of a doctor is something which requires now a caring nurse, or maybe a caregiver next to your bed, or maybe a doctor back on your, that kind of a feeling is also making the hospitalization, which is good. And of course, we don't have to go to a hospital for many things, but if you are in a hospital, the doctors, I feel that the doctors and the teachers made a huge impact in our life during the last 1.5 years. And I found that all these nurses or the technology not even available, they become all tech savvy overnight, and they become the tech savvy heroes overnight, especially the teachers and the medical staff.
Yeah. Excellent. Thank you for bringing in that point about the touch and feel, because though we are on the video consultation day in and day out, there are many patients. The moment the lockdown is done with and the unlock, they are very eager to queue up to see us in person. So I think that does make a difference, and hybrid seems to be, the way forward. So just touch point, come physically only when needed, but there are many other areas and issues where several unnecessary visits can be avoided, saving costs, saving the time, and also making it much more convenient. So it's a mix of both the traditional way of dealing as well as the new wave of technology, which is a good blended learning that this COVID pandemic has given us. Thank you so much, Suja. Next, we move to Anurag ji. The key word that I want to focus with Mr. Anurag Pratap, who is the Vice President of the Digital Inclusion Sustainability in the leadership position in Capgemini, is your strength lies in the long-term strategic planning and vision building. So in your experience, about 5 years ago, when this whole technology in the Capgemini tech savvy people, it was almost a given that it's got many pluses. Okay, now the new wave has expanded the reach of the tech savvy population, and everybody is onto it. So long-term, sustainable, best uses of technology. What is your vision, sir?
No, the point is there are 2-3 things. One is that I can see Nidhi there, I can see Sakina there, and I can see Suja there. All three come from tech spaces. So for us, tech is our bread, butter, omelette in all possible sense. Whether it's 5 years ago or 10 years ago, this is where we got our bread. This is the place where we got our omelette, sauces, whatever you want to call it. The canvas is changing, and everyone will agree and also in the sense recognize that requirement has changed, tech has changed. I'll say the character or contour of tech has changed in all possible sense. What has happened in the last 10 years or so is that one can witness two India in all possible sense. One India which is very high on tech, which is very high on the expertise, skill set, knowledge attached to tech. And this India is using all these to access all the opportunities which is there due to tech. Whether it's when Raghavendra was talking about the Telmed, or when Suja was talking about some of the things. This is the India which is high on tech, is accessing all these opportunities. There's a sizable India which is lacking. They are way behind the tech skills, expertise, knowledge. And that's where I'll say huge amount of work that not just Capgemini, but I'll say SCL or Infi or Philips, all these companies where the tech is the key word they are trying to play there to ensure that we get larger number of people who appreciate, acknowledge, understand, and then apply the tech. So that's one catchment of work that's happening there, and happening there in a big manner. And I'm not going to restrict myself only to Capgemini, because I'm like, this is the ecosystem play that's happening there. And then the second work that has happened there and happened in a very, very sizable manner is the work on solution development, on application development, where from, I'll say, using AI to what is called diagnose, reading your reports, to, in the sense, getting into a small center to get all your tests done, then test reports getting by default sent to designated doctor, and doctor studying that particular thing. There's a huge amount of investment that has happened on, I'll say, creating solutions and creating applications to ensure that you get the benefit of scale reaches out to people. So when Raghavendra was saying that getting 3.6 million people within few months is possible because tech, in the sense, acted as an enabler there. And that's what the role that tech is playing. So you'll find what is called online automated tests getting developed. I do find X-rays getting done using tech. I do find what is called people wearing devices, which is, in the sense, capturing your vitals. And these are the, I'll say, innovation that has captured the imagination of people. That's another element. And this is, in the sense, impacting a huge number of people. And this is reaching out to, I'll say, those last miles which were earlier difficult to reach out to. Tech is helping in that particular sense. Third, which has acted as an enabler in a major way, is the I'll say cheaper data cost, which in the sense ensured that anyone and everyone can access some of these solutions that people are developing. And second is the speed of the data. Yeah. So, but today it's easier now. I remember the day when we were like 2 Mbps speed was considered to be a damn good speed as far as the internet connectivity was concerned. And today, if you get even 100, you are complaining, saying that, hey, I'm still getting buffering. So and that's where I'll say huge work that has happened both on the cost of the data and on the speed of the data, which has enabled some of these systems and some of these solutions to work. Create that connectivity that was needed to connect the masses with the health service providers. Fourth, which is, I'll say, I can see a huge role that, and it's linked with, I'll say, the IT companies also realize there's a huge business opportunity is there in this particular sector. And the moment you bring in, I'll say, a business case to some of these challenges there, it in the sense, it captures the imagination of many of the, I'll say, business guys. And that's one of the reasons why you saw in the last, I'd say, 3-4 years, huge investment happening in this particular space. So that's overall, I'll say, the change that I have witnessed in the last few years, and what I can assure that coming another 2-3 years will be huge in this particular space, and the impact will be at a level where if you are not digital, you are not available. Which in the sense means that if you do not have, I'll say, digital presence, people are not going to believe whether you are present or not. And that's these days it's happening everywhere. So the moment you take Anurag name, or you take Nidhi's name, or Sakina's name, people are going to check and on the internet to see who they are. Similarly, the moment they are going to talk about solutions, or they're going to talk about doctors, or they're going to talk about, I'll say, the revolution that has happened in health space, they are going to check on the net. And if you don't have applications there, if you don't have a digital solution available there, you won't get the skill that Raghavendra was talking about. Yeah.
There are two little things again, Anuragji, which I want to quiz you on. You said business opportunity. The point of care devices, which are like the huge need, because even the semi-skilled or hardly any skill transfer is required to use those devices, but they provide such a fantastic bit of information from a remote place, and then it's so easy to use all those point of care innovative devices that are coming. So how do you foresee that as an advantage on one hand, and some flaws within itself where there may be some challenges in actually making the right kind of interpretations, the quality check of these devices, because a dime a dozen may just come through there, because the cost is, again, a huge concern in our country. So whatever is available, cheap they may, and then it may just get onto the circuit of misinterpretation, if you may call it. So what kind of challenges do you see, even if all these do come into force? Yeah.
No, there has to be some control over some of these devices. It can't be, I'll say, anyone and everyone can come in there and start interpreting it. Because whenever you consult any doctor, they'll say that the worst enemy of theirs is Google for them, because people start diagnosing their health using Google there. And then they add, I'll say, anxiety on that particular thing, because if you go to any disease on Google, end of the day, end of the sentence or end of the blog, they'll be saying that this is fatal. You can die also. So from fever to, I'll say, any serious one, they'll say that one of the side effects is that you may die. And if you leave it open to anyone to come out with devices which is going to interpret, you are going to create huge amount of problem. Pricing certainly is India is a price sensitive market in all possible sense. So even oximeter, which is like 1,500 rupees to there was someone who was selling me, or they gave me a quote of 600 rupees per piece. So just imagine the gap that is available there, and you can also understand why something is being sold at 1,500 and why something is being sold at 600 rupees. So there's a huge need for regulating some of these spaces. But I also feel very strongly, Hema, that sometimes market itself will regulate you. Sometimes the larger alliances will itself will regulate you. I don't think, and be very caustic, straightforward. Step one, or Capgemini or Infosys, we won't be able to operate in India on our own. We need, I'll say, huge amount of collaboration and huge amount of, I'll say, cooperation with each other. There's a need to build that critical mass so that we start deciding what is the right thing that it should be going there. Yeah. And let the market, let these kind of forums and these kind of, I'll say, platform, in the sense, put a stamp saying that, yes, this looks good, this is not good, this should go, this should not go. And there will be some heartburns here and there. There will be some, I'll say, frustrations here and there. But at the same time, in a longer run, you need to see that misinformation should not become another pandemic.
Right. Thank you so much for this very insightful and very, real situations which could develop in future, which we need to be guarded and plug it right at the start. So we now, whilst thanking Anuragji, we move to Sakina, where I understand that, Philips is working with a variety of social issues. We are just, largely focusing on health so far in the couple of deliberations which we have had. But your organizations, Philips India, I'm aware of the fact also that education, healthcare, water, sanitization, disability, skill development, and whatnot. So as how IHW Council also believes, good air, good food, good water, and good health, it's a holistic mix which just gets us healthy and prosperous in a way. So again, taking the cue from Anuragji's thing of collaborations, it's good, but it's not always easy. And therefore my question to you, Sakina, is these are clearly different sectors and segments, but all should merge to reach a common goal that your CSR activity may have. So what kind of opportunities you've had to cross-connect and make things happen on the ground, and what have been your challenges? Sakina.
I think what everybody said so far has been really great to understand from a viewpoint of what they would have faced from a technological point of view. Philips being a technology company, so always technology and innovation was part of our foray in CSR as well. So we never did any project. We didn't have a component of technology or digital innovation in it to make sure that it is sustained, it remains for a long time, because we won't be able to support a particular initiative beyond a certain time. So what happens after that? But when you look at collaboration, the CSR law came into force, which is unfortunately only in India. So when you look at the law 2014 onwards, you see a lot of organizations working in silos. You see a lot of corporates struggling with how to manage those initiatives, how to make sure that they have the impact that they are looking at. Earlier, it was looked at more from a charity or philanthropic driven exercise, but gradually over a period of time, corporates realize that it's something that has become a part of the core competency that they have, how they link it with their business, how they have shared value in this particular aspect of doing social development through CSR. Now, when you look at collaboration, I don't think there's any other way for us in future. If we think that we'll be able to make a dent on anything that we pick up as a CSR initiative, I don't think that's going to happen. Obviously, you'll pick up and you'll do a small initiative for a small set of population, and a lot of things might change for them, and maybe have some sustainable solutions provided to them, but that's not going to be enough. So how do you make sure that those changes have a ripple effect and they are scaled up in other locations as well? So in Philips, we have a division called Access to Care. We work on access to care. Our motto is to reach out to 400 million people from the underserved communities. Well, underserved communities may have access to finances, but may not have access to services. So how do we make sure those services are provided to them? So Philips cannot be a solution for everything that has to be required on them. So we try to collaborate not only with like-minded corporates, but also with innovators, social entrepreneurs, and also non-profit organizations to see a mix. And you will see a lot of examples in the projects that we do that have technology as the base, that have service delivery also a component, because we cannot just say technology and just forget about service delivery. We have social entrepreneurs doing the stuff for us, which they have proved, but there's no taker for them. And we try to use and utilize their expertise into those innovative solutions provided at particular location. and try to replicate it. Now, when it comes to collaboration with corporates, we are also in touch with a lot of corporates who have very similar views of thinking. It's just a matter of trust. When two corporates sit together, so there's a first tussle of visibility. So is it my visibility? Is it your visibility? But I think we have crossed that path. I think we have crossed a path where corporates understand. If we work together, if we join hands, we'll be able to make a lot more difference, which is a lot more sustainable and which can be replicated and scaled up as well. Obviously, considering India as a country, it is diverse. So you can't have one solution that fits all. You will have to customize it. You'll have to make sure that it is for a specific population or a region. And that happens with those discussions happen. Obviously, they are longer duration discussions where you talk collaboration, you talk about what is there, which is a part of their core competency, and what is there, which I have as a core competency. So when you look at examples of the diverse work that we do, whether it's education, healthcare, skill development, our core is healthcare because we have skills in-house, which we can utilize in our social space as well, which help us a lot in drawing certain solutions and technological innovations for those CSR initiatives. But we also make sure what is there with other corporates, which they can put into practice, where they can help and support and inform. So healthcare becomes the core. While we have education and healthcare, we have skill development in healthcare, we have disability in healthcare. So these core components make a part of it, because you cannot just look at healthcare as only hospitalization, providing basic care. We talk about preventive healthcare. We talk about making sure that people are able to take care of their own basic health concerns. We also talk about service delivery. We also talk about telemedicine. So COVID was not a changing pattern for us. The only thing that happened with COVID was because we had to cut short certain projects because they were not permitted to work on ground. So we diversified those projects into COVID support. We made telemedicine centers, which may not have been there earlier in the project, but we made sure that they're up and running. So I think that was a collaboration with the partners. So that helped us quite a bit reach out to those areas which we couldn't have been able to do.
Yeah. So another question to you, Sakina. Philips as a organization focuses a lot on research. So how they put in their energies onto research to identify the needs, the gaps, and come out with innovative devices, and then, get that implemented. And where does technology lie in the midst of all of these?
See, I think any innovation you can't do without research. So everything is research based. So we have research centers which are very well known. In India, we have one in Bangalore, which is called Philips Innovation Center, where all the research usually happens. So while we are making innovations for the bigger hospital requirements, but we're also making and trying to create solutions for last mile. So just to give you an example, we have a solution called MOM, which is maternal obstetric monitoring, which is a solution which is required by women the day she conceives till the child attains an age of 2 years. So it's an entire pattern created for mothers in villages, rural areas, in small towns, and through ASHA. So where we trained ASHAs, we did obviously research follows a understanding of testing the solution. So we tested it in Karnataka, in Agga district. We did a test with 5,700 women, and not even a single maternal mortality during the testing year.
Excellent.
And it was a solution that was meant for the last mile. So it is a part of something which is a part of the business, but also making sure that it is reaching the last mile, not catering to one section of the society.
Right.
And research is definitely not only part of the business, but also CSR as well. So anything that we do, it is drawn from a particular research or need-based analysis that eventually leads to a particular initiative being implemented.
And do you cite an example where you started with some idea because you really felt that need? That's a huge gap there. And then there's a lot of, time and energy, money went into that research, but when it actually hit the ground, it did not work.
Well, yes, I'll say we're still struggling with MOM because it is working wonderfully, because we did it here, we started it here, it is working wonderfully in many countries. But in India, it is a little bit of a struggle for us because it's the acceptance that you have to understand the solution and the usability of it.
Yeah.
So the acceptance is there. Unfortunately for us, ASHAs and A&Ms were supposed to do it. They're anyways overburdened. And then giving them a technology, training them, making sure that besides the work that they're doing, they should make sure that this technology becomes a part of their core. They understand, they agree, it's going to reduce a lot of their workload. It's going to reduce the data entry thing as well for them. But I think that's something I would not say it is. I say it's a challenge, but I will not say it's not something that we won't overcome. Right. And it's extremely an extremely innovative solution that we had created because mother and child is the main focus everywhere. When you look at even the Ayushman Bharat, you look at health and wellness centers, you look at mother and child as the main focus. Everything is around them. So what are you trying to do? You're trying to make things easier for them. You're trying to make train Ashas gradually on these aspects as well. So I think that is something that we are pushing, and we are trying to reach out to those and making sure that we close the loop, not just provide the solution, but making sure that the people who are going to use it are trained regularly on the usage and making sure that there are no discrepancies in terms of capturing those details that are required for a healthy mother and child.
Excellent. Thank you for focusing on that behavior change and the skill building. Both of these need to be in place to continually wait, because that's one wonderful moment when they realize that it comes in so seamlessly that they can't do without it. So that is the stage that they have to reach, because even we have seen in our own settings in the metros as well, very many educated assistants, they're so used to manual documentation. You ask them to get onto the electronic mode. It is, in the healthcare segment especially, there seems to be more of a barrier than the usual as per our experience. So thank you, Sakina, for those wonderful inputs. Lastly, now Nidhi, who has been so patiently waiting for the question that we need to pose to you. She's the director of the HCL Foundation, Mother and Child, very important component. And then we move on to Nidhi, who has been working a lot on the actualization of the child's right, including the policy and implementation work on child protection. How does technology fit into this bit? The children, their rights, and the issues around that.
Right. No, thank you so much, Hema, for all the interesting deliberations. And I think a lot has been said around technology. And I think it's a panel where we are talking about health in general. Of course, child rights protection is a completely different piece of work, I would say. And so far, I don't think, lots of good stuff has been said, but I just want to be a little bit of a devil's advocate here. See, COVID also caught us with a lot of surprise. It's not that we were ready, and little bits of technology we had here and there. We just played with it, and we somehow managed to get out of this chaos. Of course, we've also supported a whole lot of command centers, coordination centers. We've strengthened the disaster risk response centers. We've worked with the relief commissioners, and we've got ventilators on ground and PPEs on ground, and got so many hospital beds and oxygen and everything. Like, I would say, things were moving at a jet speed, because the wave 2 was definitely a much bigger disaster than the wave 1. I'll come to the child rights protection piece later, but coming to the topic of this particular panel where we're talking about health, of course, technology is playing a role, be it telemedicine and be it, even the entire biotechnology sphere as we talk about it in the healthcare sector. But, eventually, if I talk about public health in India, and if I talk about the SDG goal number 3 and our own health policy, 2017, which is very clearly laid down the universal healthcare for all, as well as reduction of out-of-pocket expense for people, I think we are lagging quite badly. Let's kind of be very truthful, such that we really set some realistic goals and leave the business aside. I think as a company we have quite a number of technology companies. We're all doing quite well, and we're really contributing towards the global technology solutions, so as to say. But if I talk about the CSR in India, of course, we all have programs which are quite focused, and with our communities, we are doing quite well. But the unmet need, as we call it, especially in the field of health, that's way too high as compared to the solutions which are available or the kind of projects which are being rolled out. I think earlier, Raghav talked about the scale. which essentially is the issue here. I mean, and health, it really needs to be broken up. Then health is not like one particular issue. If you really break down health into, different lives. I mean, goal number 3, SDG goal number 3 is quite clear about well-being of all across life stages. And I think Sakina was talking about the first 1,000 days. I mean, we recently finished a research in urban slums, and the data is so stark in eyes. I mean, less than 3% children covered for deworming, less than 10% children being given the vitamin A dose, less than 50% children with complete immunization, contraceptive supplies failing, and this is, I'm talking about the urban communities. So while, yes, we can boast about the technology solutions, but what's the reach? What's the reach? What is the gap between availability, accessibility, and acceptability, where the utilization of healthcare function is a function of all these three? So there is definitely a huge gap for that. Not only corporates need to come together and work, and we are a big believer in the concept of convergence. So it's about having the public, and it's a public health, and health is a subject of the state. I mean, there is a complete budget allocation at the state level, at the central level. Now, we should not do the mistake of mixing the COVID-19 response with the regular public health issue, because we are anyhow on several indicators, infant mortality, maternal mortality. I mean, there are states like, Uttar Pradesh, and then you do a state-wise gradation. I think there is a whole lot of work. Look at Northeast. I mean, we are working in PHCs in Northeast. We've strengthened under our HCL grant. PHCs, when we entered there, I mean, women had to minimum, travel for 18 hours to reach the nearest possible PHC for her ANC checkup. And then we are talking about 4 ANC checkups to be, and, consumption of iron folic acid to be seen, and tetanus toxoid, TT injections to be seen as a complete antenatal care package. Now, just imagine these situations. Telemedicine, yes, it provides solution, but health is a matter of personal touch. Health is a matter of well-being. It's a matter of rights of the citizens, where the caregiver needs to be in contact with the person who is availing these services. So I think overplaying technology will do harm in this situation. At the same time, where technology really has a role is the larger biomedical solution, biotechnology solutions. Of course, the whole hospital care system runs around that. But the public healthcare system, I think there are 3 points where we really need to, whatever we are doing in our own individual programs or even as together, I think all of that is great. But where is the scale needed? The scale is essentially needed in having the right primary data. Primary data also, which is available right now, is madly divided into rural and urban. Within urban, there are stratas. If I start looking for slum data, it's just available for 9 cities through NFHS. Why? All cities have one or the other way urban poor. I mean, we really need to have specific data on the urban poor, followed by larger access. The patient doesn't know, or the mother in a slum or mother in a rural area doesn't even know where she can go. So the larger awareness part, where media partners also really need to participate in a big way. I mean, you see a whole lot of advertisements and some of the compulsory ads, but none of the TV shows will show you, hey, walk up to this distance for your first ANC or the second ANC checkup. So I think those are kinds of shows, and other issues. I mean, I'm talking about mother and child health more, but similar stuff for geriatric care, similar stuff for non-communicable diseases, NCDs, which is really entered across. I mean, for the second time, I guess we have NCD data in the NFHS also being counted. So that's another. And the third bit where we really need to scale up technology is that making the caregiver feel as close as possible. So I think the telemedicine solutions, there is a ray of hope out there. But how do we really, and that's where, public-private partnerships are critical. extremely critical. We can all join hands and join with the state, but eventually the responsibility and the accountability does remain with the state, and that's where we really need to, I'm a big believer of convergence out there and need to have that. So thank you so much.
Absolutely. Thank you, Nidhi. I know that Anuragji wants to respond on one particular point, but I would also like to respond. Yes, mother and child health care, public-private partnership, because when you're saying the NFHS data, whether it's in the slums or whatever, it is only the government data. The private hospital data is also completely a blotch. It is missing. So in my mind, the technology can actually help us in all the three prongs. One is the advocacy to raise the demand. The people, the girls, women should know what is their right to, access and what they need for themselves, even in terms of vaccinations and the number of times of AHC care and what they should be given, etc. So the advocacy is, like media, the technology, like WhatsApp University, everybody is aware of, and Dr. Google, as mentioned by Anurag. We have to be out there in the space as professionals to tell the right kind of messages, authentic and, the myths and misconceptions busted. And the data, yes, it is lacking. What you have found is not complete, but things cannot be better than that. They are maybe worse, but they are not better, as how, the 10% blood test for these, and instead of 4 checkups, 1 check, and this is the deworming has not happened, etc., etc. So that is for sure. So how can we make it better? There again, the technology-driven data is actually helping us, guiding us, making us learn the lessons, showing the mirror to us. See, your perceptions may be different, that in your ivory tower, you're doing a great lot of work, but the reality out there is quite different. So the research part of it, the data, even if it is just in some parts of the data, just gives us a clue that here is where you need to invest your energies and time. And the training or the capacity building, which has been so well alluded to, again and again, reinforcing, we generate the demand, but we have to strengthen the quality of the supply as well. So all of these things, I do believe, that can be packaged into, a better reach with access through technology. And then, as you said, let's connect and let's make it happen. Anuragji, your response.
No, I know I'm hitting at, this is the fag end of the call, but there are a few things which I don't agree, in the sense that India is a huge country. India, you can't have touch point all the time. Let's move out from the whole romantic idea that a doctor should be there for every patient, and every doctor should personally touch that particular individual there. The problem is that we are huge. There are too many people. And somewhere tech need to, in the sense, reinvent itself, and there is one application work that's something that we are developing, where expecting mother, number of tests, you can do it using the device itself. You don't have to actually go to the PSC to get those tests done. You can use those reports and directly consult with the doctor. The point is, we can't ignore the very fact that this is a country where still a sizable population, you need to be explained that why you should get vaccinated. This is a country where a sizable population will still go on the street saying that, hey, you can't force me to get the test done. This is a country where you still have, I'll say, a civil society which will, in the sense, go out in the market saying that, hey, every person has a right to say no, even to the vaccination also. And in that particular space, there is a need to use tech to create or break certain myths, and in the sense also remove those physical touch points, boss, because we have lived with that particular fallacy for too long, saying that we need to create PSCs in every point, every place, and that's the reason why this is the state that we all are in right now. That's where I wanted to just add in there and pitch in there.
One small bit I want to add, Anurag, to your point, because when I said strengthen the supply side also, many of our girls and women do not find any value in visiting these centers, because just not, it's just they just come and go, and they're not even given few seconds, and the kind of it is a touch point, but it is not quality driven. It is not good enough.
This is taking 70% of your planned expenditure at the state government. If you remove these planned expenditure, you in the sense make it leaner and meaner, you can use this particular money to do some innovative work. Raghavendra, in the sense, talked about the 3.6 million. Can you do it through physical mode? And can we say that what they did was inferior to what the actual, I'll say, touch and feel will be doing that progression? That's a debate that we all should be getting in there.
This is a very exciting closure to this panel, because as intellectuals, we all should agree to disagree. Okay. That is where we are putting our minds really strongly with a clear intent of doing something better. And as we have always said, a collective directive to what best. Even then, of course, we will have to make course corrections as we go along, because scenarios change, our thinking process changes, the world is changing, as we can see right under our eyes, and we come together because nothing is right or wrong, and everything is needed in the due proportions. And always the philosophy in India should be something is better than nothing.
Yep.
If they cannot access anything at all, at least telemedicine. If they can come, okay. If they can use a remote device to check the baby's heartbeat, and the mom gets, little stronger into implementation, then Sakina, we should be much more happier. And step one, steps ahead, several more steps, and the long-term strategy inputs from Anuragji, and the ground realities exposed by Nidhi and Suja, saying the best of both worlds. How can we bring together the haves and have-nots? So this has been a delightful churning of our brains that we have had in the last 60 minutes, which makes us reflect within ourselves about how much more and how much better we can do. But India is a complex country, but it is also a country of hopes, and it is a country where we have the courage and determination that we will be able to move the needle and change the healthcare ecosystem in the future. So on my own behalf, and on behalf of Kamal Darayanji and the entire team of IHW Council, who's been doing an exemplary job of getting a variety of stakeholders together on a platform to think, because before the action, some thinking, some planning, plan your work and work your plan is the motto, and then we will together we can do, is always my closing mantra. And I really hope that we get together yet again to do something more, something better for this great country.